My name is Andrew Rokito, and I am Chief of the Division of Shoulder and Elbow Surgery here at NYU Langone Health and co-director of the Shoulder and Elbow Fellowship. We are proud to be one of the premier shoulder and elbow divisions in the nation and have a tremendous amount of enthusiasm for what we have accomplished and for what we plan to accomplish in the future. Our fellowship has been in existence for over 2 decades, and throughout this time, our objectives have always been consistent. For every fellow to develop a comprehensive understanding of the management of virtually all aspects of disorders related to the shoulder and elbow, to develop all the clinical and surgical skills necessary to treat these disorders, to gain the expertise needed to avoid and address the inevitable pitfalls and complications that will be encountered when treating patients with complex shoulder and elbow disorders, and finally, to acquire the skills necessary to conduct and complete clinical and basic science shoulder and elbow related research. As a fellow, you will work one-on-one with our core shoulder and elbow faculty members. In addition, you will also have the opportunity to work with several other surgeons whose practices include a significant shoulder and elbow component, including members of our trauma and sports medicine divisions.
For the year long that you're here, I think it's a great experience because we get to work together for a year as opposed to a 2 or 3 month rotation. I've developed great relationships with our fellows in the past, and I look forward to the opportunity to do that each and every year with the fellows that join us.
I need to first emphasize that despite our high clinical volume, we only take 1 shoulder fellow per year. This has been a conscious choice by our group in order to optimize and to not dilute the overall fellowship experience. As a result, there are no rotations at outside satellite locations, and the fellow will be working with each one of us every week at our main campus locations.
While the NYU footprint extends throughout the New York metropolitan area, as a fellow, your clinical activities will be primarily at NYU Langone Orthopedic Hospital, the Outpatient Orthopedic Center and Surgery Center, and the Ambulatory Care Facility. While this is a surgery-focused fellowship, ample time has been built into the schedule for outpatient care, including working directly with faculty members in the clinic and during office hours. Each year, our fellows will log, on average, 700 surgical procedures.
I'm often asked, what is the surgical volume at this program? And I will tell you, at one of the largest academic orthopedic institutions in the country, the surgical volume is significant.
Our program offers an extremely robust and a complete clinical experience for the fellow, which in my humble opinion, is really unmatched elsewhere. For example, for the past 5 years, all of our fellows have completed at least 500 surgical cases, some over 600. In addition to almost 200 primary shoulder arthroplasty cases, a typical fellow would also participate in about 50 revision shoulder arthroplasty cases as well. Our fellows also complete at least 150 arthroscopic shoulder cases and about 60 elbow cases, with 15 to 20 of these being elbow replacement surgeries.
Additionally, there's good combination and mix of surgical autonomy, as well as first assisting some of the great surgeons that are at NYU Langone. Additionally, the academics are well supported with didactics and research opportunities for the surgical fellow.
The Fellows Didactics include monthly and weekly conferences like Journal Club, Indications Conference, Pre-Op Conference, and Grand Rounds. In addition, the Fellow has opportunity to mentor residents in the office and in the operating room. We have a robust setup for conducting both clinical and translational research, which is one of the strengths of our program. There are ample research opportunities, and the faculty is committed to conducting research. You will have access to the research team consisting of research assistants, basic science faculty, biostatistician, and faculty in the biomechanics lab.
The fact that you get an opportunity to work with many different faculty members, learn many different ways to do things, because ultimately when you finish here, you'll have acquired the knowledge and experience to go and develop your own practice specializing in shoulder and elbow surgery.
Upon graduation, all of our fellows have moved directly onto positions of their choosing, including full-time faculty academic practice jobs, multi-specialty group practice jobs, as well as positions in both large and small group practices.
But what I would say that what sets this program apart among others is the camaraderie that's within the shoulder and elbow division. Certainly you will be a part of that and see that amongst the attendings, but also you will see that with the surgical staff, support staff in the operating room, as well as the nursing staff on those patient floors. I was treated as family from the first day.
As a graduate of this program, you will not only be part of a strong, cohesive fellowship alumni network, but you will also be an integral member of the NYU Langone Orthopedic Surgery Alumni Association and forever connected to our department and its mission of education, research, and service.